In April 2009, the H1N1 virus, or swine flu, was detected in a 10-year-old child in California. 3 days later, as more cases were discovered, the Center for Disease Control and Prevention alerted the World Health Organization. The virus was soon discovered in Mexico, and 10 days from the first discovery, the World Health Organization declared the H1N1 outbreak a public health emergency of international concern. 2 years after the outbreak, 16 scientists from 7 different countries, including Egypt, Russia, and Thailand, gather on the Utah State University Logan campus. They are here to learn about vaccine biomanufacturing in preparation for any future virus outbreak. Part of the training involves classroom instruction.
In your case, in a bad thing in a biopharmaceutical setting, because
one Romanian scientist, Adrian Coero, shares some of what he is learning in his training.
In a simple way, it's a project that allows us to learn all the new technology to improve the influenza vaccine manufacturing. So we are here to train to make a faster influenza vaccine in case of pandemic all around the world.
The course, instructed by Utah State doctors Kamal Rashid and Bart Tarbit, is part of a program funded by the U.S. Department of Homeland Security's Department of Health and Human Services Biomedical Advanced Research and Development Authority, or BARDA. Utah State is one of 2 schools in the nation to receive the grant to host the scientists for 3 weeks and conduct the training. The other school, North Carolina State University, began their training February 28th. Dr. Tarbit says Homeland Security has made it a priority to train international students in biomanufacturing as a safeguard, a way of protecting the people of the United States and the world.
They're charged with protecting American lives, and you could think of, influenza virus as it's a major killer, a major cause of respiratory diseases and death, especially in non-vaccinated people. And I guess the idea is, with regards to a pandemic, that influenza is really going around the world. If we could stop it from spreading in Southeast Asia or in Egypt or in Australia or someplace else, it's really benefiting our people.
One way the program aims to accomplish this is by teaching the manufacturing of animal cell-based influenza vaccines, as opposed to egg-based vaccines. Dr. Rashid covered this segment of the training.
We are trying to show them how to improve the egg-based, but at the same time we are trying to show them how to go to cell-based, where they can produce the viruses in animal cells, which could be a much efficient way of making large quantities of vaccines. To give you an example, if you wanted to produce enough vaccines for a U.S. population of 300 million, you need 900 million eggs. That is a lot of eggs. We're trying to convey to these groups that if they move to cell-based vaccine, then they can utilize animal cell culture in large-scale operation, utilizing bioreactors to mass produce the vaccines so that they will be ready in a case of pandemic.
The visiting scientists gather around instruments in the lab while Dr. Tarbit instructs. The training includes a combination of lectures and practical learning, and is expected to be the type of training Delia Abdel Rahim can use for instructing other scientists when she returns to Egypt.
What we are learning here comprises both the educational, and we are learning and we are practice what we learn. And this is hard to find anywhere. You can have it either academic or practical, but when both are combined, I think it is something very beneficial and very important for all of us.
Adrian also looks forward to teaching his colleagues in Romania. What type of impact do you see coming from your training here for your country?
Well, for sure, it's 100% impact, and maybe, who knows, in 2 years, maybe we will be able to produce a cell-based influenza vaccine, but depends a lot. I think we will provide all the necessary information back home to our bosses, letting them know we were listening very, very much.
It would be beautiful, said Dr. Rashid, if every country could produce enough vaccines to treat their own population.
If a guy becomes infected with the virus in Vietnam and come to US, they may bring the virus with them to US and we get it.
Right.
So if we protect them elsewhere, we can protect ourselves too. If we all, in the next decade or so, all these countries become self-sufficient in production of viral vaccines for treatment of influenza, then we have a healthy world.
And a healthy United States, as intended when the Department of Homeland Security funded the program. Reporting for Utah Public Radio, this is Jesse Dredge.